Good morning guys. Okay, hari ni just a fast one. Okay, mengulas topik tentang mengulas topik tentang gastritis yang kita bincangkan semalam sebab banyak sangat soalan terutamanya tentang pemakanan and that kind of thing. Okay, saya buat live sambil buat kerja. Okay, alright. So just untuk nak bagi you a bit more detail, okay, about pemakanan, because a lot of questions in the video yesterday as well as in my inbox juga. Okay, alright. So let's see. So whoever who's online can ask me questions today. I allow you, okay, to ask me questions, okay, about gastritis, okay, and we can talk about food a bit today. Okay, let's look at the few questions that I wrote down yesterday about yang diajukan kepada saya. Okay, now number one, okay, kenapa, actually yang ni ramai yang tanya sebenarnya, kenapa kalau saya makan kacang dal saya jadi gastric? Okay, alright. Now let's talk about, so that is one, and then the second one is about susu, okay, and the third one is ramai yang kata saya makan on time, okay, but actually this one I did explain yesterday, but let's go one by one. Okay, first of all, bila anda mempunyai sakit gastritis, okay, ubat dan juga pemakanan adalah sangat penting untuk it has to go side by side. Okay, just say lah, for example, saya bagi ubat tapi awak belasah sambal belacan. Okay, you belasah sambal belacan, sama je, dia takkan hilang. Okay, sebab you pedih ulu hati, and sambal belacan tu akan menyebabkan ulu hati tu masih pedih lagi. Okay, so pemakanan yang tepat dan ubat yang tepat, okay, bila dibuat sekaligus, okay, akan menyebabkan anda lebih cepat lega. Okay, so pemakanan yang elok untuk gastrik adalah low oil food, okay, that means makanan yang tidak berminyak, okay, high fiber food, okay, like grains like lentils, which is dal, okay, oats, okay, and then green food like vegetables, okay, green vegetables like bayam, okay, sawi, broccoli, alright. And then lean meat, okay, lean meat like chicken, okay, chicken, turkey, okay. So this kind of food, okay, and fatty fish, okay, fatty fish like salmon, okay, tenggiri, this kind of fishes, okay. So cara anda masak tu harus mengikut apa yang saya kata, iaitu tidak harus berminyak dan juga tidak boleh pedas. Okay, so these are the type of food. Okay, so then it contributes to the soalan yang ada yang tanya, kenapa bila saya makan oats saya gastrik, padahal saya kata oats boleh makan, and then kalau saya makan dal saya gastrik. Okay, sebab semalam bila saya menjelaskan tu, remember saya kata gastritis ni ada beberapa punca atau penyebab dia. Okay, even simptom dia ada yang jenis, okay, pedih ulu hati, okay, lepas tu ada orang gastrik dia jenis kembung, okay, dia makan sikit kembung, rasa senak, okay. So the reason why anda perlu berjumpa dengan doktor dulu sebab kita nak cari punca dia dulu. Just give me 1 second. Okay, alright. So kita perlu cari punca dia. Okay, so let me give you an example. Contoh, bila anda makan oats kan, siapa boleh makan oats kosong? I cannot. Okay, so bila anda masak oats, anda akan masukkan susu. Okay, so just say anda mendapat gastrik bila makan oats dengan susu, itu bermaksud susu adalah tidak sesuai untuk anda. Most of the time, walaupun if you Google or that kind of thing, a lot of people say that cold milk can actually help to reduce the gastric, tetapi kebanyakan orang sebab perut dia berasam, especially yang pedih ulu hati, bila mereka makan susu, minum susu, benda tu akan menyebabkan lebih teruk. So sebenarnya dairy products kita harus avoid dalam sakit gastritis ni, seperti cheese, okay, and all those kind of things. Okay, alright. So in that case, what you can do is you can try oats dengan air, like, without susu, okay, without susu, and then see whether it causes you gastric or not. Okay, so the second one, which is paling common, these two things was the other one is dal, okay, ataupun lentils. Okay, lentils are high fiber, low density food, which is actually very good for your stomach. Tapi jika anda jenis gastritis tu, Encik Rahman, suara saya dah kuat dah. Tak boleh lagi kuat. This is very close already. Dekat loop depan pun boleh dengar dah. I think I nak beli mic. Ada orang suruh saya beli mic pakai kat sini. Tapi saya rasa kelakar. So, rasanya kena beli kot. Tak boleh lah lagi kuat lagi. Okay. Hi, good morning Encik Azmi. Thank you. Encik Ismail. Yes, I'm coming to that. I'm coming to your thing. Okay. Hi. Abah Noah, okay, thank you. Alright. Lentil. So, jika anda mempunyai gastritis jenis kembung perut, then yes, kekacang boleh menyebabkan perut anda kembung. Okay, so indirectly menyebabkan anda rasa senak, tak selesa, nak belahak, okay, ataupun rasa macam nak sendawa tapi tak lepas, macam tu. Okay, alright. So, these are the types of pemakanan that you cannot take. Okay, so can take, but maybe it affects you in a different way. But you should avoid dairy products. So what you should avoid, okay, adalah, kuat tak suara tu? Okay, so semalam I told you, remember, alcohol and then painkillers macam tu. Okay, so you should avoid food that is oily, okay, pedas, okay, buah ataupun sayur yang acidic. Okay, now you see Malaysian food very famous, okay, especially Indian and Malay food are the tomatoes. Okay, tomatoes, alright, are actually fruits, not vegetables, and mereka adalah masam. Okay, so you should avoid that. So apa-apa, most of the time kebanyakan buah ada gula. Okay, indirectly it contributes to gastritis, tetapi terutamanya buah yang masam anda tidak boleh makan. Okay, terutamanya perut kosong lah. Okay, then next is caffeine. Okay, caffeine is coffee. Samo, siapa nak jawab samo? Ada soalan kat sini. I saw just now. Oats and Milo. Tak sesuai. Kenapa? Okay, because caffeine is not only coffee. Guys, always remember, even tea has caffeine. Okay, teh, whatever pun ada caffeine juga. Cuma, dose caffeine mereka adalah berbeza. And what is Milo? All my patient, I kata, jangan makan coklat, jangan minum coklat. Pasal dia pun kata, Doktor, Milo boleh kan? Milo tu brand, okay? It is chocolate, and chocolates contain very high doses of caffeine. That's why if you rasa bad mood and then you take chocolate, you feel good. Okay? Alright. So you should avoid chocolate, which means that, of course, the brand yang paling famous that we know is Milo lah. Okay, but any other drinks, okay, any chocolates. Okay, next is starchy food, macam makanan berkanji. Okay, nasi, benda yang ada yeast, roti, okay, that kind of thing lah, you should avoid juga. Okay, now some people akan jadi gastrik yang teruk bila makanan dia ada bawang putih, bawang merah dan halia. And please, almost 95% pesakit menggunakan teh halia panas ataupun air halia panas bila gastrik, okay, and trust me, dia akan menjadikan inflamasi dalam perut anda semakin teruk. Okay, so untuk gastrik anda sepatutnya minum air masak saja. Okay, alright. Air masak saja. This is your best friend. Okay. Tapi also jangan, sometimes you rasa macam tak selesa kan, and then you keep gulping so much pun tak boleh juga. You have to take dalam small doses. Even kalau kat cap ni, you can pour in the cap and then drink a little bit by little bit. Okay. And you can take slightly cool drinks. Okay. Not with ice cube, but slightly cold or cool drinks. Kalau anda pakai kowe tu macam tu, you can take that, you will feel better. Okay, now let's look. Today is more of saya tak ajar, saya nak jawab soalan sebab semalam saya dah ajar dah. Okay, punca-punca gastritis ada banyak. Okay, ada berpunca daripada macam semalam saya katakan alkohol, pengambilan ubat radang, pengambilan ubat tahan sakit. Ya, you can open. Tadi you all cakap dengan patient tu. Tak apa, biar buka je, okay? Lepas tu ada yang disebabkan penyakit kronik seperti penyakit jantung ke, lepas tu penyakit kencing manis ke, okay? Contoh kalau anda ada penyakit jantung, makan aspirin pun boleh menyebabkan gastritis on the long run, okay? Lepas tu ada autoimmune disease, okay? Autoimmune disease. Lepas tu contoh jika menghadapi kanser menyebabkan pemakanan yang kurang, so menyebabkan gastric lah. Okay, so other than that, high sugar food. Sambungan dari tadi bila saya ingat saya akan cakap. Okay, high sugar food like carbonated drinks, processed food. Bila doktor kata ada sakit gastrik ni, jangan pergi makan makanan pedas. Pergi makan moi. Pergi beli moi kat Mary Brown lah sungguh. Beli moi kat McD lah. Processed food. Okay, because those are fast food. Of course lah dia moi, tapi cara mereka masak tu tak macam kita masak. Kena masak kat rumah. Okay, so kena diet. Makanan tu tak boleh ada garam banyak, tak boleh ada bawang putih, bawang merah. Abang Noah, mic clip power juga. Doktor, brand Boya, murah tapi power. Okay, Cun, kita pergi shopping mic. Atau you belikan tu, I pesan tak kat klinik boleh tak? Okay, alright. Dok, I suka makan pedas like ghost pepper ramen. Oh my god. So, Encik Azmi, looks like you cannot take that lah because it's too spicy. Yes, it is bad. Okay, jika anda seorang peminat tegar makanan pedas tetapi bila anda makan, anda mendapati anda sakit dada ataupun sakit pedih ulu hati, itu bermaksud jangan makan. Okay, itu maksudnya memang you suka pedas tapi you tak boleh makan lah. Alright, kena spacing out. Okay. Dok, kenapa saya makan coklat saya sembelit? Sebab kafein banyak sangat. Okay. Suraj, hi. Oh, this is so sweet. May I humbly ask, can yogurt cause me to have reflux? Yes, Suraj. Yogurt can cause you to have reflux because it is sour and usually dairy products, especially reflux. Okay, patients, gastritis tu lain, reflux, okay, GERD, GERD, reflux is a bit more serious. Okay, so reflux is something bila asam dia terlalu tinggi, bila anda makan something yang sour, memang dia akan menyebabkan reflux lebih teruk. So you should avoid dairy food. Okay. But my doctor, okay, Casmitra, my doctor said that I just started gastric very less. I just started gastric very less, and when I admitted for scope, they gave me Milo and okay. Casmitra, I think I understand your question. There is a slight uncommon gastric which is actually caused by very low acid levels in your stomach. Dah habis jangan dulu. Let him rest first. Ask him to eat. Tell him I'm coming to check. Okay, alright. Now, very low acid levels in your stomach can also cause gastritis, but that is a different one. So maybe that's why when they gave you when they did the scope and everything, you needed a different treatment. Okay. Now, soalan Kasmitra ni sangat-sangat bagus. Kenapa? Sebab ini adalah soalan ataupun statement yang menunjukkan kenapa sesuatu penyakit tu sangat penting untuk anda berjumpa dengan doktor untuk kita determine punca anda sakit. Alright, then only we can treat you. For example, saya kata Milo tak boleh, tapi dalam condition Kasmitra dia perlu dan diberikan Milo. Okay, so you get my point kan? Okay, gastric tak boleh ambil vitamin redoxon ke? Sorry I tak hafal brand. Sekejap, I check. Vitamin redoxon. Apa tu? Is it multivite or is it vitamin C? Sebab most of the time doctors kami hafal ubat. Kami tak hafal brand. Okay, alright. Okay, it's a vitamin C. Okay, okay, alright, okay. Now, if you have gastritis, you can take vitamin C tablet. Okay. However, kalau anda makan vitamin C tablets and benda tu menyebabkan anda pedih ulu hati, especially macam redoxon yang saya tengok kat sini, dia soluble. Okay. Actually, I jenis macam tu. Okay, okay, most of the doctors have gastric lah because of our job nature. Okay, but I do have a very bad gastritis. Okay, di mana saya memang tak boleh makan vitamin C. Saya makan, tak boleh tunjuk brand. Okay, saya makan acid free vitamin C. Kenapa? Because I need vitamin C to boost my immune. But whatever brand that I take, saya dapat pedih ulu hati yang teruk. Okay, so I have to take acid free one. So if you take that and then you feel that you pedih ulu hati, you can try the tablets. And then if you try the tablet pun sama, then you should either change it to acid free ones. Okay, but always check with your doctor. Okay, alright. Now, I just want to comment about Kasmitra tadi yang low acid level tu also hampir sama juga tau gastritis yang jenis macam tu. Okay, ada juga kembung, ada juga pedih ulu hati, tapi mereka akan ada simptom yang lain seperti maybe a lot of pimple problem. Lepas tu kita akan nampak makanan yang tak digest dalam dia punya najis dia. Okay, so that kind of thing. So it's slightly different lah. Okay. Alright. Okay, thank you. Siapa-siapa puji tu, dia malulah saya. Okay, saya ada IBD. IBD totally different condition. You must be very careful with your food and your intake. Okay, alright. Saya nak break 1 minute. Okay, saya nak pergi check patient saya sekejap. Keep asking questions, I'll come and answer you. Okay, welcome. Okay, alright. Doktor nak tanya sikit, orang ambil alkohol, biar batu boleh hancur keluar. Batu apa tu? And kalau memang biar ni boleh menghancurkan apa-apa batu, saya pun nak beli simpan kat klinik jual ke patient. Okay, now hyperthyroidism boleh buat perut mudah upset tak? Some people, if you are sensitive, yes, but also maybe like I said, chronic disease depends on your what you call that, medication that you take. So you have to check balik the type of medication that you take, then is it that may be causing you to have gastritis. Okay. My leg keep pulling if I eat dal, potato, my stomach one some. Okay, alright. Now, this is one thing, Laura, which I just explained again and again. The symptoms of gastric is one of it. Okay, now, this is one important thing, which in her sentence that I want to tell you all. Jangan ambil ubat tahan sakit. Patient yang datang jumpa saya sakit perut. Kalau gastric, kalau anda makan ubat tahan sakit, okay, akan jadi lebih teruk. Kalau sakit dada kiri kanan tu sakit apa? Tak tahu, kena jumpa doktor. Boleh makan sebarang kari? Soalan yang sangat bagus. Actually, kari ada spices, which means that in gastritis you should not eat curry. And that is Indian curry that's like has a lot of spices in it. The Malay curry has lesser spices but had santan in it, so no. Apakah tanda awal gastric? Pi belakang semalam, pi tengok saya punya video. Saya selalu sesak nafas.
Ada injection dekat Islam kan?
Ada.
Ada.
I masuk dalam tu.
Dekat chest, angkut tak?
Okay. Saya selalu sesak nafas disebabkan angin banyak dari perut. Okey, memang betul akan sesak nafas. So, silakan makan ubat. Kalau saya buang air besar, berdarah, lepas tu makan pedas dan sakit bahagian perut. This is yesterday. Saya dah explain kalau anda dah berak berdarah, is not good. Okay, very serious already. Okay, most welcome Suraj. Amy, I don't suggest you to drink susu dan sapu minyak angin. It's best to get some medication. And yes, correct. Tak berani minum teh tarik atau nasi goreng. Memang kalau makan akan sakit. So remember just now I taught you all? Yeah, okay. Now, vitamin C, thank you. Sakit dada terasa cucuk kiri kanan. Kenapa dok? Kena buat ECG dulu. Pastikan bukan sakit jantung. And then we can see about it. Okay, alright. I think that's all good. Always feel hungry when gastric. Why, doctor? Very good. Okay. That is one more thing that I wanted to tell actually and keep forgetting. Okay, now when you have gastric, okay, the food gets digested fast because the high acid levels that actually break down the food. Okay, so that's why balik kepada soalan saya lupa tentang kertas ni yang saya tulis tadi. Okay, ada patient tanya kenapa kalau saya makan 3 kali masih gastric. Actually, bila anda ada gastric, anda harus makan lebih kerap lagi. Okay, at least 5 to 6 meals a day. Break the meals, eat smaller portion meals, okay, and then it will reduce the hunger feeling and also reduce your gastritis very well. Okay, sakit gastrik sekali dengan dada sakit, susah nyawa. Yes, betul. Tanda-tanda sakit batu karang. Hari ni kita tak bincang batu karang. Okay, alright. So I think I have completed all the questions here today. Okay, so all the best to you all. Okay, and all the best in listening to the video and understanding about gastritis and what you can do about it. Okay, alright. Now, I think there are few more people asking me about makanan. Makanan saya baru explain from the beginning, so you guys have to go back to the video in the beginning and listen to it about what food that you should take and what food that you should avoid and everything. Okay, because I have to go, I have patience. Okay, and then Shira, when pregnant, you always will have gastric. Whether you have the sakit ke tak, semua patient mengandung akan ada gastritis. So you follow, you just listen back to what I explained about the food just now. Okay, alright. Beza gastric dengan GERD. Also, I already told you. Gastritis ada banyak jenis. Salah satu daripada dia adalah GERD. Okay, before I go, one more. Cepat. Mr. Fuad kan, one more. Angkat tangan tapi tak ada soalan kat situ. I gotta go. Okay, I don't see the question. Alright, bye-bye. I will answer it down there if I read it later. Have a great day. Have a great day, you all. Okay. Now, remember this is part 2, gastritis. Watch yesterday's video, okay, about gastritis, part 1, and then today is about part 2. Okay. Alright, bye-bye.